Excellent. So good afternoon, everybody. It's a pleasure today to have Dr. Sherrilynne Fuller with us. So she's a Professor Emeritus for the Department of Biomedical and Health Informatics in the School of Medicine at University of Washington. So thank you so much, Sherry, for joining us today in this webinar. It's a pleasure to have you here in the Cayetano Heredia University. So we are very glad to hear your presentation. So go ahead. Thank you so much.
Thank you, Mabel. I'm delighted to be here. I wish that we were in person, that I could be there in Peru in person. As Mabel knows, I really love Peru and have been there many times. I've seen many parts of Peru. Sometimes my friends in Peru tell me I've seen more of Peru than they have. But anyway, I apologize for the phone in the background. I can't turn it off because I can't reach it at the moment. But again, I'm happy to be here. We're going to be talking today about the field of biomedical and health informatics. And I thought, given the challenge that the world has faced over the past 2 years with COVID, that I would talk about and use some examples drawn from COVID, because we have all been struggling all over the world to deal with this, and it has presented many opportunities to us for research and for practice. So let's talk a little bit about me, my background. What have I been doing? Mabel asked me if I would say a few things about some of the areas I've worked in. I have done research in and taught in a number of countries across the world. My work with countries, particularly at the national level in Kenya, Tanzania, Namibia, South Africa, Peru, of course, Thailand, and Vietnam, and to look at challenges for designing national health information systems that are equitable, that treat individuals fairly and responsibly in terms of their information and sharing their information, and that are representative of all of the people in countries. And that's a continuing issue in the United States, to be sure that we have the records and the information for everyone so we can deliver healthcare appropriately. I've also worked on clinical information systems, medical record systems at the University of Washington and in the United States and beyond, to the public, to work on systems to improve health, including epidemic surveillance. Long before COVID, there were other diseases, epidemic potential diseases of concern, and those systems to prevent or to monitor and warn about epidemics are really important areas of work. And I particularly worked in Southeast Asia, helping develop some systems. Most recently, I worked on a COVID project that developed reports for the State Department of Health as the disease information emerged about COVID-19. And I'll say a little more about that in a few minutes. My academic areas, I have taught graduate students, particularly at the University of Washington and around the world. I led the development of the biomedical informatics program that is now a department at UW, and also worked on graduate programs in health informatics in Peru and Thailand and Vietnam. And one of the most interesting experiences of my career was serving on the US President's White House Advisory Committee on Information Technology. That was a most interesting experience. It spanned 2 presidents, Bill Clinton and George Bush's administration, and it was the most interesting experience. And I think that our recommendations actually did make some difference to the development of medical information systems in particular. So what is informatics? And you ask 10 people, you will get 10 different definitions. So I'll give you mine. My preferred definition is the study, design, development of information and technology for the good of people, organizations, and society. So it includes both the engineering side. I know many of you are engineers, the technology side, but it also includes the data, the information, and the combination with the people for the good of the people as the center piece of that development. So what is biomedical informatics? This is informatics in the context of health and biomedical challenges. And those challenges range from personal health, your own health conditions, to the health of societies, the public's health. Very often people, and I will say engineers, are some of those people, think that informatics equals technology. It does not. A computer is not informatics. It's a tool to do informatics. Information technology in general, all of the computers and systems and wiring and connectivity are simply tools in support of collecting, using, manipulating information. So those are the definitions that we'll be working with. We'll see more of this in action in the future slides. So this is a description of a typical health informatics and biomedical informatics setting. So you have health informatics, which talks about the use of information by doctors, healthcare providers, healthcare services, and health information technology systems, the systems that share information. Biomedical informatics is the people, includes the researchers who do clinical trials to develop vaccines, the people who look at diseases of many people to figure out what is causing the disease and how to treat it. So the research side, and we'll talk more about the biomedicine, biomedical research, biotechnology, and cloud computing. And I'm going to say almost nothing about artificial intelligence, but it's an area of great interest, essentially using computers, teaching computers how to behave like human beings. And that has been something that has been of interest for as long as I've been involved in computing, which is my entire career. And we still aren't doing very well with artificial intelligence, in my opinion, but it's a really interesting area, and there are some limited applications of it that are working in health. And that's all today that I'm going to say about artificial intelligence. Turning to the right side of the slide, the clinical informatics side, it's the physicians who need IT in order to do their jobs, to collect the medical information and to put it into medical records and health records databases. The clinical information that supports decision-making, so that when a physician writes you a prescription, they are warned that you're allergic to that particular drug and you should choose another drug. So there are alerts and reminders that are the information part of clinical practice. And then there's the technology side of clinical informatics, the medical imaging, which is one of the earliest applications in biomedical informatics. Medical imaging and radiology was one of the earliest uses of technology applied to medicine. And then nursing has used informatics and computing and information systems in a variety of ways, the patient record, of course, but also in these at the bedside to monitor patients and to look at how patients are improving in terms of day-to-day health. So that's a large picture of biomedical informatics and the component parts, the various specialty areas. Perhaps you can see yourself in some of those settings of particular interest. Perhaps you're interested in the imaging side or in the technology side of putting those systems together to help support decisions by physicians and nurses. Those are all really interesting and areas that in just about every country in the world, there will be jobs and opportunities. Looking specifically at personal health records or medical records, there's a lot of work that is being done around the idea of mobile personal health records. And in fact, in Peru, there have been a number of projects by one of our colleagues, Professor Raza, and my colleagues, Walter Curioso, who has done some work in this area. And the whole idea of collecting your personal information and then having you able to communicate what is happening to you personally through that record and information system is what this particular slide is about. It's a slide by one of my colleagues and from Kenya, who I worked with in Kenya on a number of projects. And he's now here in the US at Vanderbilt University. But he's done a number of very creative, what are called digital health interventions, working with patient records and providing self-monitoring communications from patients so that they can share what's happening to their personal health through the health record system. And in this time of COVID, being able to do this at a distance is really helpful. For example, being able to monitor a patient at home who is having difficulty breathing and getting their oxygen readings directly through this mHealth system and into the medical record is a very important part of healthcare in this new situation that we are living with. So again, that's the personal health record, all of your personal data and information and the ways that it is collected and used and shared between the patient and the caregiver. And to look at a specific example of a medical record system that's in use around the world. I, in fact, particularly worked with it in Kenya, where it is used very widely. It's called OpenMRS. And there was a development. I don't know the status of that development at this time, but they were using this OpenMRS medical record system in Peru and other countries in Central and South America for COVID monitoring. So collecting patient information, clinical status, exposure, and travel information and outcomes. And these were some of the countries: Chile, Colombia, Guatemala, Haiti, Mexico, Peru were a part of that development process. I wasn't able to update what the status of that project is, but I thought it was a very interesting application of OpenMRS. Again, it's in use. It is free and open software, and it is in use around the world for medical record systems. Okay, turning to specifically another type of technology that has been extremely heavily used. I've used it a lot myself as a healthy patient to talk to my doctor. I haven't seen my own doctor in 2 years. I tend to be very healthy, but she insists on seeing me via telehealth. frequently or fairly frequently, just to be sure that I'm okay and to check on my vital signs and so forth. So there's a number of types of telehealth. Live video conferencing, which is obviously quite common now around the world for seeing patients. Quite a few places, though, need to do this asynchronously. In fact, I was explaining that to Professor Raza that yesterday we had such a bad storm here that I wasn't sure I would be online today. The power was coming and going, and I live in a part of the Pacific Northwest that is very close to Seattle. By boat, it's about 20 miles to downtown Seattle, but to get there is not easy. And our communications our internet is very unpredictable. So being able to use asynchronous video to store and forward images, X-rays and other images in settings where there is limited internet capability is a very important part of medicine in a lot of places, including in Alaska here in the United States, where there are not live internet connections. They're very slow and very fragile connections. Another type of telehealth is remote patient monitoring, actually being able to get diabetes testing done in real time, but being able to constantly monitor the patient's levels or glucose levels, or being able to monitor their breathing and the oxygen status. So remote patient monitoring is certainly another area of telehealth interest. And then finally, mobile health, which I mentioned previously, the use of patient views of health records and monitoring information. And so being able to have the patient reporting on when they take their medication, that they've actually taken their medication, and how they are doing is a whole very large area of mHealth, and it's been very helpful. There's been a number of research projects around taking drugs for diseases that require very precise dosing at very specific times. And so using mHealth, you can make sure that the patient is doing and following these very specific guidelines that they're being asked to follow. So let me stop there. And if there are any questions, I think we have a way to get questions to me. I think Professor Raza can ask me and I can explain or answer questions. But let me just pause for 1 minute and see if anyone has questions for me.
Sí, si alguno se anima a tener alguna pregunta para la doctora Sherrilynne, dice que se sientan cómodos de poder hacerlo durante la presentación. ¿Alguna pregunta? Sherry, I have one question. One question for you. So, so you were talking about how the OpenMRS was using for collecting data from the COVID patients.
Yes.
So you know the results about that? If they got some insights about how efficient was to collecting the data in that way, or any insights about that?
That's a really good question. And unfortunately, when I found that late yesterday afternoon, that project existed, because I hadn't been following what was going on with OpenMRS recently. And when I found it, I didn't really have time to follow up and see how far they had gotten with the project. But OpenMRS is very good about communicating what they're doing. They have a very good website. And so I suspect you could follow up online and check to see where that project, what the status of that project is. OpenMRS is a very good software for medical records, and it's quite customizable and quite easy to use, both for the care provider as well as the developer and the people that maintain it. It's been quite heavily used, as I said, in Kenya in particular, throughout the health system. And so I'm hopeful that they've made that it was helpful and that they were able to get sizable databases, because once you have built a database for one country with the proper privacy and security in place, you could build a large database of findings and look at the findings across the countries. So, okay, thank you for that question. Let us look a little more at telemedicine. Again, because many of you are interested in the engineering side, and telemedicine has a lot of reliance on technology to be successful, I wanted to be sure that we talked more about it. The settings for telemedicine, obviously beginning with the patient, looking at various areas a patient might use telemedicine. One of the interesting areas is e-learning. So if you are a patient and need to learn how to care for your, after surgery, for instance, you've had surgery and you need to learn how to use, how to change the bandages for you and your caregiver, e-learning has been used a good deal for teaching patients to take care of themselves. Obviously, for telemonitoring and tracking of how a patient is doing, remote consultations, managing drugs, all of these things are areas of telemedicine interest and capability. And it can be either mobile internet, or it could be a landline, a simple phone line that is used. Using devices such as video cameras, mic speakers, sensors. There's a lot of research going on sensors that would feed back information to the healthcare team. Remote sensing of oxygen levels, in particular with COVID. Communications, how the technology actually interfaces across networks. All of the types of devices, and I think I have all of these devices. I have a desktop computer on my desk, I have a laptop, my smartphone, my PDA, and a tablet. I have two, a PDA and a tablet on my desktop, literally within reach of where I'm sitting right this minute. But all of those are very valuable in use for telemedicine. And all of the care team can make use of telemedicine. So clearly, it's a very important part of care today, even more important than before the COVID pandemic, for allowing people to stay in their home but get care. Okay, now we're going to turn to another area of biomedical informatics. You've probably heard of bioinformatics, and it is not another word for biomedical informatics. In fact, bioinformatics, I apologize for the spelling error, by the way. I noticed that at the last minute. Bioinformatics is the science of storing, retrieving, analyzing large amounts of biological information and data. So the data may come from electronic health records, may come from gene sequence databases, the genetics databases, or from laboratory-based analysis. So bioinformatics depends on all of these fields: statistics, data science, which comes from computer science, and biology, the biology of the human being. Now, this is an area, bioinformatics is an area of particular interest in my department of biomedical informatics. I will talk a little bit about a couple of projects, research projects they're working on today, now. approaches to doing biomedical or bioinformatics, the data, collecting data. And this is where the concept of big data comes from. You've heard of big data. Well, some of these databases are gigantic. Imagine a database of personal health records for, 50 million people. Imagine the amount of data that would be contained in a COVID database drawn from the personal health records of 50 million people. That would take a lot of data cleaning, statistical and visual analysis, and you need a lot of different kinds of software to do that analysis. And you need really good modeling and simulations to even present what those findings look like and what those findings mean. So very, very large engineering challenges in doing bioinformatics research. And I think we'll turn now away from bioinformatics to my personal favorite area of interest and the one I've worked in the longest and had the most interest in. So about 25 years ago, I was working on medical record development, clinical information systems, web-based medical record systems at the University of Washington and around our Pacific Northwest region with hospitals. And I ran into a very interesting physician who is also he's a rear admiral in the public health service in the US Public Health Service. And he was very, very interested in getting me to come to work in the area of public health. And his words to me were, you know, Sherry, you can keep saving one patient at a time with medical records, or you can work in public health and look what you can do. And this slide is a slide that Dr. Patrick O'Carroll shared. And he shared it, in fact, with one of the classes I was teaching in biomedical informatics. So vaccinations, a vaccination isn't because a physician made you well. I mean, the work was done at the population level to figure out vaccines. We'll talk a little more about that in a minute. Motor vehicle safety. Medicine has nothing to do with the fact that seat belts save more lives than just about any other intervention could. Safer workplaces, hard hats, and making sure that where you work has healthy air. That's not medical care, but it saves millions of lives around the world. Controlling infectious diseases. We know that it's a lot easier to take care of someone and keep them healthy if they don't get sick in the first place. Safer foods, sanitation, sanitary, safe drinking water, healthy mothers and babies, and recognizing tobacco as a hazard. Most of these have nothing to do with medical care, and they're all about prevention. So Patrick convinced me that prevention was a much more, that you'd have a lot more impact if you worked in prevention. And so that's why I started working in public health, and specifically public health informatics. So public health informatics is simply applying science, information science, computer science technology to public health. And I took this from Patrick O'Carroll's book, this definition. I added, in about 2015, I started talking about the whole concept of prevention informatics, and that our approach to informatics really should be looking at ways to prevent disease and making sure medical records had a public health prevention focus in the medical record. So Here's an example of something I worked on. That's a public health informatics case study. When COVID broke out, and by the way, my personal situation, because as we talked about, I think I travel internationally a lot, or at least I did. I happened to be in Mexico with my husband on vacation when all of the flights to the United States started shutting down. We eventually got home, but very early in the COVID outbreak, I got an urgent email from the leader of the UW Department of Global Health asking me to help a team that became a team of epidemiologists, infectious disease doctors who were actually treating COVID patients, a librarian, biostatistician, and me, health informatics researcher. And she asked if we would develop a strategy for looking at all of the clinical research reports that were coming out from around the world about this unknown virus at that point. This began talking about it in March, April of 2020. And the State Department of the State Health Department in Washington State wanted us to report to them findings that could help them keep people healthy and away and prevent being exposed to the disease. So that's what we did. We put together really fast the team and a lot of software. One part of the software that we used was a database, bibliographic database called Mendeley. Maybe some of you, if you've written research articles, have used it. It's a very, very nice and free database. We began screening research articles, and by June of 2020, we were screening about between 1,000 and 1,500 research articles a day, not a week, a day. We had to review all of the articles that were downloaded from PubMed, put them into the Mendeley database, assign codes, and then decide on the 20 or so that would make the most impact and need to be reported to the State Department of Health leadership team. That included the governor of our state. And very quickly, our reports were used across the United States and across the world. We had a very large following. So we developed published reports that look like this, that show the key messages. So we would give a summary of the key messages from the 20 or so most important research articles. So we were looking at these articles for reliability. Were they really good studies? Did the data back up what their claims were? It was a very complex process, and our team used a lot of different software. We used Slack for on-the-fly communication, so we could talk to each other as we were making these decisions and writing these summaries and these reports. So this went on for a little over a year. We finished the last report in June of this year. But it made a big difference to a lot of people, and we got a lot of thanks from the leadership of the health department. And our state, I am proud to say, has been one of the states in the United States that has remained the healthiest and had particularly the lowest death rates. I just checked the numbers yesterday, and we're among the top 5 in low death rates in the US. I can't claim our reports made all the difference, but I think they made a difference in that. And having a governor who said, you will wear masks, you will stay home, the businesses will shut down, and following good medical recommendations and what the findings were, and that this was a respiratory disease, which many people didn't feel it was. So anyway, that was a small part of a contribution that I was able to make during the pandemic, and it kept me busy. So I wasn't worrying about other things while I was at home, not able to go traveling. One of the key information systems of use in public health is an immunization system. This is an example from Washington State. I know Peru has developed immunization tracking systems for people, the citizens of Peru. I'm aware of some of that work, but it's a very large project to carry out. And right now, as people are getting vaccines, making sure that the system is updated in real time is a key part of tracking how we're doing on making sure people are vaccinated, fully vaccinated. And the immunization system during normal times is really important to tracking children vaccinations too. So there's a whole area of work and development that needs to go on to support immunization systems in public health. There's a lot of other information work that needs to go on, informatics work that needs to go on in public health as well. So turning to some of my biomedical informatics research and study interests, the first paper is about the bioinformatics and medical informatics course that a group of us from Cayetano and from the University of Washington worked to develop. And it became the program called KIPU, which Regional Biomedical Informatics program at Cayetano. It was really interesting, but it was one of the first areas that I worked in when I began working in Peru. One of my first trips to Peru was in about 2002. A second area that I mentioned that I've worked in public health in particular was looking at disease threats across the world. And note the date, this was 2010, and we had just had a pandemic, the SARS pandemic. And there was a lot of interest in how you put technology together to gather data throughout countries to be warned about an epidemic and a pandemic as it was developing. And I was invited to write this paper for the journal Epidemiology based on a lot of work that I had been involved in around the world. And then the last one example is some work I did on mining and mapping the research literature, particularly clinical trials. And I want to spend a few minutes talking about clinical trials and how important they are and how much informatics, biomedical informatics work needs to be done to make clinical trials happen. In the case of my research with Telemedicine, it was about drawing connections between research findings to look at what we know about a subject and predicting what kind of research needed to happen to fill in gaps. And again, that was particularly with clinical trials. So what's a clinical trial? I suspect you've heard of clinical trials. They're very carefully designed studies to look at new tests and treatments and to evaluate the effect on human health. And the vaccine trials that you've been seeing reported for the various vaccines that have been developed around the world went through very rigorous steps. People of all ages, including children, can be participants in clinical trials. And there's very specific steps that constitute a clinical trial, from a laboratory study where you test this treatment or vaccine in animals to see if it might be safe, to what is called a phase 1 study, test the safety of the medication on a small group of people, see if it's safe. Not see if it's effective, that comes later, but see if it's safe. Phase 2, you look at the effectiveness and safety in a larger group than phase 1, slightly larger group. The clinical trial itself happens in phase 3, where you look at that vaccine in thousands of people or hundreds of thousands of people in some cases. And then phase 4, you look at the long-term effectiveness, which is what's happening now with many of the vaccines that are in use around the world. You look at the long-term effectiveness and also look for adverse effects, because as you know, some of the vaccines have resulted in some effects on the myocardium. And so looking at what happens when hundreds of thousands or millions of people receive a vaccine, looking at those adverse effects. So you can imagine with this complexity, all of the informatics challenges embedded in making a clinical trial happen. And this slide shows that whole process, the protocol, describing what is happening, how that test will be done across those phases. Case report forms for every single patient of the hundreds of thousands of patients in the clinical trial have to be collected, that data. Metadata to look at the total picture of how those pieces, how that data fits together. Data entry, well, data validation, collection, entry, cleaning, all of this. I don't know, those of you who are thinking about careers, there's a whole set of opportunities for work in all of these areas in support of clinical research. Not to mention the computers and systems and technology that needs to communicate with each other, since trials are typically done across many centers, so many universities or many places the data is being collected across a country, and that all has to come together. Okay, so let's say you're interested in biomedical informatics and you want to think about a career in biomedical informatics. Well, this is my department, the Department of Biomedical Informatics and Medical Education at the University of Washington. And we have a large research program. We also have a number of degree programs. So I'll show you a little bit about some of the research at my department is doing. This one is led by Dr. Peter Tartzy-Hornick, who is the department chair. He became department chair after I left the department. Well, I left the program. It wasn't quite a department at that point, but he was the person who took over and eventually became department chair. He's working on taking data, sequence data, and genome data, the genetics data from health records, and looking at using it for designing drugs and for testing of testing drugs. And it's a very large project with large number of people involved in the study, but it is a big data. I used that word earlier, a very large database of electronic health record information that is being analyzed and studied. Another example, another also built on electronic health data. Studying is faculty in the department who are looking at how high-cost patients could be identified and reviewed to predict ways of dealing better with their diseases. So they may have multiple diseases. And again, this is using health data from very large scale databases of health records and looking at predicting high cost patients and how they might be better cared for. And the last study that I want to mention, research project, different kind of research project, is looking at the genetics of leishmania. And I suspect that you've probably heard of this disease. It is a parasitic disease found in Peru, other Central South American countries, parts of US, parts of Europe. And I think it's caused by the bites of sandflies, if I remember correctly. So again, this is looking at genetics and looking at ways to develop drugs based on the genetics of this particular nasty parasitic disease. So that's just a little bit about some of the research. There's a lot of other types of research in our department. The programs, application, research programs, there's a research master's degree, a research PhD, postdoctoral studies. We also have an online master's degree in clinical information, clinical informatics and patient-centered technologies. So that one is an entirely online master's program that may be of interest if you saw something in the clinical framework that you might be interested in. But you can take a look at our department's webpage. The web address is here. I also have it at the end of my slides, and these slides will be available to you. So you will have access to these slides after my presentation. Okay, so if you want to learn more about what's going on in biomedical informatics, one of the key journals is the Journal of the American Medical Informatics Association. Has a lot of interesting studies, and you could take a look at that journal. There are other biomedical informatics journals as well. And so for further information, these are the web addresses. I think these are active links. And I wanted to mention something that just happened. I just found out about it yesterday. There's an International Medical Informatics Association book that was just published. And it is a compilation or a summary of people who work internationally around the world in biomedical informatics. And my career path is one of the reports that's in this particular book. So if you are interested in how I happened to start doing what I am doing, and I started literally with the beginning of computers, working with computers in brain research, believe it or not, but that's what I was doing in my very first job. This link, and it's a free and open publication on the internet. I just found out about it yesterday that it had been published. So I'm going to stop and see if there are questions. Gracias. ¿Tienes preguntas?
Yes, Ingrid, go ahead. You prefer in English or?
In English.
Okay.
I would like to ask about what are the obstacles to collect data in rural areas with a low technologic and medical development, and what are some recommendations that you would give me to do it successfully?
Obstacles to collecting data, and I think you said in rural areas. Is that what I heard?
In rural areas.
Well, there are lots of obstacles to collecting data anywhere, but especially in collecting data in places where people are perhaps not comfortable giving their data. I have been in that situation, both sides of that situation, where I have not wanted to share my information and where I've had trouble getting people to share their information with me. It's about trust, and you really need to establish trust with the people you are working with, and make sure that they understand the purpose of the information collecting and that they understand the value to them of giving that information. So that it can't be just that you want the information for your research. If that's what it is, you will not probably get a lot of help or get the data you want. So I will point to a project that I know the person who's led the project. And it's a project in Peru that's led by one of our colleagues, Professor Raza, and my colleagues, Magali Blas, who's working with women in the river areas in the Amazon and beyond. And she has been very much about training women and health workers to help make sure that women and babies are delivered in a healthy way. And because she has established relationships with these communities across the Amazon region, she, I would predict, can get data and information that she needs to help improve the program she is building. So again, there are obstacles to collecting data, but the most important way to make sure that you are able to collect it is establishing trust. On the technology side, I haven't said much about it, but there are some very good data collection tools for cell phones that can be used to collect the data. So you don't have to use paper to collect the data, and you could collect it and share it. And I could share with Professor Raza some of the software that I'm thinking of if there is interest. So I hope that answers the question.
Thanks.
Other questions?
Sherry, I have one question. So what do you recommend the students who would like to do research in biomedical informatics?
Well, I think that finding areas that are problem areas for people who are working in healthcare, that one of the things that can be done is to ask physicians that you know personally, or perhaps the pharmacist at your local pharmacy, bodega, right? Or a nurse that you know. Ask them about what kinds of challenges do they have, but then put on the information challenge hat. What is the information? Translate what they are telling you. Don't ask them what their information problem is. They won't know what you mean. But if they tell you, if the pharmacist tells you they are having trouble tracking inventory, that's an information problem. They're having trouble, say it's a nurse, communicating with patients because they lose them. They don't come back for care. That's an information problem. So put on your hat of what's the information problem, but ask the general question of what are the problems you're facing? I'm sure that one of the problems health workers in Peru are facing, they certainly are facing it here, is getting immunizations to people, finding people where they are and then tracking that the immunization got done. It's a giant information problem. Does that help?
Yeah, thank you. Mm-hmm. Yeah, that was great. Yes, as you were saying, to put in the shoes of the professionals, the health professionals, to know what are the challenges in problems in general. So it will be excellent as a start. Okay, great. I think we have a question from Pablo that was raising the hand.
Yes, thank you very much for the talk.
You're welcome.
I was thinking like, in terms of computer-aided diagnostic systems, do you think we are going to move to fully automated anytime soon, or like what are like good ways to benefit from that kind of systems in our time?
That's an excellent question, Pablo. And so I know the developers of one of the earliest diagnostic programs, one called DXplain, which was for disease diagnosis, and one that I don't remember the name of, but it was for cancer diagnosis. And these were very early programs in the 1980s, 100 years ago. Many of you were probably not born in the 1980s, but the problem, to cut to the chase, the problem is computer-aided diagnosis is not welcomed by physicians. Now, why do you suppose that is? Do you want to spend, I don't know, 8 years in medical school and postgraduate study and so forth to go into practice only to be replaced by a computer? So the early computer-aided diagnostic programs were not welcomed. They worked to a limited extent. They gave ideas of other diseases you should think of, but the physicians said, you're just trying to replace me, and I can't be replaced because I'm a human being who studied all of these years and I'm better than any computer. And they are. Humans are better than any computer. So if you use a computer to help a physician, remember that whatever the patient's problem is, might be leishmaniasis, rather than the easy, the allergic to clothes or whatever, that computer can expand the types of diseases that a physician thinks of, or, spotlight. But making sure that computer-aided diagnosis isn't about replacing physicians. It's more about giving them ideas of the broad scope of disease, and also reminding them what not to do. Does that answer your question, Pablo?
Yes, thank you very much.
So just the last question, okay, Sherry. So what do you consider will be the challenges in informatics from the next generations?
Bill, that's a really good question. I think that the challenges are particularly around being overwhelmed by data, being overwhelmed by, we were overwhelmed. 1,000 research articles a day coming out on COVID. I don't believe that it's changed. It's probably 1,500 a day. that are actual research studies coming out about COVID. You can't possibly make sense of those 1,500 research articles a day. You can't keep up with a field. So I think that's one of the big challenges. It's a challenge that we faced in the last 10 years, 15 years, but it's snowballing, it's getting worse. So I think that's one. And I think that another is making health information systems more equitable so that everyone is included and everyone benefits from health information systems. And we know that is not true today. We know that in the United States, there are many people who wanted to get vaccines early on in my own area who couldn't because they didn't have a computer to make the vaccination appointment. You needed a computer because or a cell phone at least, that you could be very quick and know how to use the system to get those early appointments. It changed later on. The health department opened it in ways so that people didn't have to use computers, but people who are elderly, I guess people would think I am elderly, but people who can use computers and cell phones were disadvantaged from accessing healthcare, and still are. And I think that's another enormous challenge, that we build information systems, telemedicine systems that are equitable to all, regardless of where you are, and that reach everyone, even if you're in the Andes and the high Andes, where there is no reception for cell phones or internet.
Okay, so there is any other question? No? Okay, so thank you so much, Sherry, for your talk. It was very interesting to know about all the pathways related to biomedical informatics and know about your expertise. So thank you, Pablo. Thank you, everyone, for joining us during this webinar. I don't know if you have the last words to share with the audience, Sherry.
Well, I'm very grateful to all of you for participating, and I look forward to seeing you in Peru in person one of these days and speaking Spanish with you, because I am trying to learn Spanish. I have been working on it for many years, and I am determined to have a conversation in Spanish when I visit next time. So thank you all for participating.
Thank you, Sherry. So yes, we are looking forward to see you here in Peru. So thank you so much, everybody. Bye-bye.
Bye.
Bye. Thanks, Sherry.
Thank you. Thank you, Mabel. Say hi to your family.
Thank you. Bye-bye.
Bye.